So good morning to all of you. In last couple of videos, I have discussed about quinolone already, aminoglycosides, introduction and mechanism of actions already discussed in the last video. In this video, I am going to discuss about ADRs, clinical uses, ADRs, and contraindications of aminoglycosides. So clinical uses of aminoglycoside is limited, and particularly we are using these antimicrobial agents when another agents are not working or another agents are showing resistance. Microbial resistance happens with other microbial agents, antimicrobial agents. So in that case aminoglycosides will be used. They are used alone and in combination therapy for serious particularly gram negative infections. So serious pseudomonas infections they are using in combinations. Brucellosis is another infections where they are used in the combinations. Another use, clinical use of aminoglycosides, if you see the classification of anti-tuberculosis drugs, you will find streptomycin is used as a first line anti-tuberculosis drugs. It's also a drug of choice for plague. Another aminoglycoside which is used in the treatment of tuberculosis, but it's used as a second line of anti-tuberculosis. The drug is amikacin. The drug is amikacin. So that is its use. Again, I am repeating, these aminoglycoside we are using particularly when other agents are not working or there is serious conditions. In that conditions we are using aminoglycosides. Why their use is limited? There is some serious ADRs are associated with aminoglycosides. As you know, they damage to sensory hair cells, so it leads to hearing loss. They also damage the inner part of the ear, also damage that one, and which leads to trouble in maintaining balance of the body, maintaining balance. They also damage the nephrons, particularly damage kidney toxicities, nephrotoxicities. It also leads to nephrotoxicities. These toxicities happens particularly, these are after the proximal tubule, it's filtered and it leads to damage to kidneys. Another but not very frequent ADR is neuromuscular. Another ADR is neuromuscular damage. So particularly you have to be use very cautiously when your patient is have pre-existing. So contraindication is when patient has a pre-existing hearing, vestibular, renal impairments. So in that conditions you have to be use very carefully these agents because it leads to a toxicities. Another thing is when you are expecting that duration of therapy is more than 5 days, you are using aminoglycosides in a patient. So in that case you should perform some bed test for, particularly you have to be performed to check the cochlear and vestibular functions. So how you use these cochlear and vestibular functions? There is some test by which you have to be do. The test name is whisper test. One is whisper test, as its name indicates. In that test, what you have to do, you have to be speak some combinations of words and letters you have to be speak, and then after that you have to ask the patients to repeat it. and it is always you have to be the examiner should be stand behind the patients to avoid the lip reading. So it should be behind the patients to avoid the lip reading. So these combination of word, if the patient is repeating correctly, that will it will pass. If not correctly, then you have to repeat this test 6 times. Again, new combinations of letter and words, and if patient is passing more than 3 times, so saying correctly, answering the correctly, then that this test will be passed. If not able to answer correctly these words or repeating that words, then you have to be send the patients for the audiometry. So this is normally is particularly these aminoglycosides, because these are leading to a hearing loss. So you have to be very careful. Another things with the aminoglycosides is it leads to a resistance to aminoglycosides. Major mechanism is there is a enzyme inactivations happens, and enzyme activations particularly through adenylations, acetylations happens, or phosphorylations. And in aminoglycosides, as you know, there are the narrow therapeutic index drugs. So TDM is required. TDM is therapeutic drug monitoring is required. Therapeutic drug monitoring is required to absorb the concentration of the drugs in the plasma, whether it is crossing or not, because little with cross will lead to a toxicity problem. So this is all about your uses and ADRs and contraindication you can't use. So thank you. In next videos I will discuss about the next units. Thank you.